A&E figures are worse than at any time since records started in 2004. 1 in 10 patients who need admitting is waiting over 12 hours for a bed. It's undeniable that the NHS is under extreme pressure. 18% more people have turned up to A&E departments in England in the last 6 weeks compared to the same time last year. 9,500 people are in hospital with COVID. That's more than doubled recently. Add on to that almost 4,000 with flu, another sharp increase. This means that 13% of hospital beds are being used for COVID and flu patients.
We know that for every 82 patients who wait for more than 6 hours in an emergency department, there's 1 associated death. Now, at the moment, in many emergency departments, we're lucky if we even see a patient within 6 hours, let alone get them admitted to hospital within that time.
The Royal College of Emergency Medicine claims between 300 and 500 people a week are dying because of these delays. NHS England, though, insists there's no evidence for that. It says there are several complicated reasons why we're seeing higher death rates than usual coming out of a pandemic.
We have got some people who are having to wait much longer than either we or they would want. And that is uncomfortable for everybody in the NHS, which is why NHS staff are working as hard as they possibly can.
You've said you're deeply uncomfortable with the level of care that some patients are getting right now. But your job is NHS England's Chief Strategy Officer. What is your strategy for fixing this?
There is a very clear plan: recover services, get back to delivering the long-term plan and transform the NHS for the future.
And all this comes with more strike action planned by NHS workers this month. Catherine Burns, BBC News.
Well, our political correspondent Ben Wright is at Westminster. Ben, this more pressure on the government to be seen to be doing something to help the NHS.
Yeah, pressure that's cranking up, I think, by the day, Clive. This isn't the first winter crisis the NHS has faced, but it could be one of the worst. And the huge demand that we're seeing on hospitals right now, again, exposes the fragility of healthcare systems across the UK, from huge numbers of staff vacancies through to a shortage of hospital beds, which is a symptom of the ongoing crisis in social care. On top of that, ambulance workers and nurses, as Catherine said, will walk out again later this month. And for patients, target after target is being missed, and many are having a miserable experience. Now, politically, the state of the NHS in England is becoming a real problem for Rishi Sunak's government. Ministers say it is a #1 priority and point out that money has been poured in. An extra £14 billion over 2 years was announced in the autumn, another £500 million to try and free up hospital beds this winter. But record spending isn't improving care or productivity. And Labour's argument is that we're seeing the consequences of years of underinvestment, and they say that the Conservatives have now run out of ideas. So as pressure on the NHS grows, so it does on Rishi Sunak's government, both to tackle this crisis and try and find a long-term fix.
Ben, thank you. Ben Wright there at Westminster.